Cardiologist on statins for 10 years dies. LDL levels only 70. Many people over 40 in the US take statins for high cholesterol, but there's growing evidence of side effects. Doctors often prescribe statins first when they notice high LDL cholesterol. Let's talk about what this means for your health and what other options you might have. 7 alarming ways statins can cause harm or even death. Pay attention to this. It's important whether you're taking a statin or not. But first, remember to click the thumbs up and subscribe button to stay up to date with my live videos off grid. As always, audience A, your answer to this video are 1. Statin-induced myopathy, 2. Cataracts, 3. Cholesterol function impairment, 4. Hyperinsulinemia, 5. Testosterone reduction, 6. Depletion of vitamin K2 and coenzyme Q10, and 7. Increased level of homocysteine, and all this happens from statins. So there you have it. You can either Google each point or continue watching, as audience B would definitely like to watch and understand how to actually overcome these issues. Statin medications are commonly prescribed to help lower cholesterol levels, but they can sometimes cause problems with the muscles. One condition that can develop is called statin-induced myopathy. So the muscles become painful, weak, and inflamed. Researchers have found that this is a major reason why some people stop taking their statin medications or don't take it regularly as prescribed. So the muscle issue can actually become even more serious than just pain and weakness. See, statins have also been linked to a condition called rhabdomyolysis, and this is potentially dangerous situation where the muscle actually starts to break down and the contents of the muscle cells spills out into the bloodstream. And one of the proteins released called myoglobin can actually damage the kidneys and potentially lead to kidney failure. Thankfully, rhabdomyolysis is not an extremely common side effect of statins. However, the milder muscle pain and weakness is more widespread among people taking these cholesterol-lowering medications. I found some research that has shown that making sure you get enough vitamin D can actually help improve these muscle symptoms for some statin users. Now make sure you are taking 1000 IU of vitamin D3 per 25 pounds of body weight. Next up, we have the issue with cataracts. This occurs when the clear lens in the eye becomes cloudy, leading to impaired vision, and the lens of the eye actually has a high lipid or fat content. This means the lens relies on the cholesterol that your body naturally produces in order to function properly. Now, when you take statins to lower your overall cholesterol levels, this can have an unintended impact on the eyes. If you impair your body's natural cholesterol production, organs like the eyes may not be getting enough of this important substance. And when that happens, the eyes can start to deteriorate, leading to development of cataracts. A 2013 study looked at data from 46,000 people and found that those who were taking statins had between a 9 to 27% increased risk of developing cataracts compared to people who weren't on these cholesterol-lowering medications. So, if you're one of the many people taking statins, it's important to make sure you're getting your eyes checked regularly. But how exactly does this work? Well, cholesterol is actually produced in the liver through a complex process involving an enzyme called HMG-CoA ductase. Statins work by actually inhibiting this enzyme, which in turn causes the liver to produce less cholesterol overall. So the tricky part is that more and more research is showing it's not just your overall cholesterol levels that matter, it's the quality and function of that cholesterol that's important too. So when cholesterol is artificially lowered through statins, other parts of the body like the eyes, brain, skin, and arteries may not be getting enough of this essential substance. Blocking the enzyme in the liver doesn't only affect cholesterol production, which brings us to hyperinsulinemia. Back in 2013, there was a really fascinating study published in the remarkable title, Do statins cause diabetes? Well, the research found that the answer is actually yes. Statins can indeed increase the risk of developing diabetes, particularly in older people, women, and those Asian descent due to genetic factors. The hyperinsulinemia, this means having too much insulin circulating in the blood. See, our bodies rely on insulin to actually help use the glucose from the food we eat. It's kind of like a key that unlocks our cells so the glucose can actually enter. But when our cells don't respond well to insulin, the pancreas tries to compensate by producing even more of it, leading to this hyperinsulinemia. And this insulin resistance is one of the main hallmarks of type 2 diabetes. Typically, type 2 diabetes develops due to consuming too many sugars and carbs while spiking blood glucose and insulin, but with the statins, the process seems to work in reverse. Researchers believe the medication itself interferes with the cell's ability to properly respond to insulin. So even if someone is doing everything right in terms of diet, now when cells don't respond well to insulin, it causes glucose to build up in the blood, leading to hyperglycemia or high blood sugar. So the other side of diabetes coin. So in fact, the Centers for Disease Control openly acknowledges on their website that statin use can stop the body's insulin from doing its job properly, putting people at higher risk of type 2 diabetes. And of course, once you have diabetes, that can trigger a whole host of other health problems. Things like nerve damage, blindness, poor circulation, kidney damage, reduced immunity, and ironically, even increased cardiovascular disease. It's kind of the opposite of what the statin was meant to prevent in the first place. Next, we'll turn our attention to 3 nutrient deficiencies related to statins and how you can make sure you're getting enough. But first, don't forget to download my free ebook listed within the video description. See, testosterone is often thought of as the male hormone, but it's actually important for both men and women. See, in men, it's responsible for things like a deeper voice, body hair, and sperm production. But in both men and women, testosterone plays a key role in maintaining muscle and bone strength, as well as regulating mood, energy, brain function, sleep quality, and libido. The tricky thing is that cholesterol is involved in the production of testosterone and other important hormones. So when you take a drug like statin that artificially lowers your overall cholesterol levels, it can also interfere with your body's ability to produce these vital hormones. While there isn't a huge amount of clinical data specifically measuring the impact on testosterone, a couple of trials have looked at this. They found that after 48 weeks of taking a 40 milligrams daily statin dose, patients experienced a 7.5% reduction in testosterone. And with even a higher 80 milligram daily dose, the reduction was 10.3%. So the more statins you take, the bigger the potential impact on your testosterone levels. There have been also some medical cases studies identifying men who took statins for cholesterol and experienced a significant reduction in their sex drives. Further testing revealed their testosterone levels had dropped below the normal range. But when they stopped taking the statin, their testosterone levels went back up to normal and their sex drive reportedly improved. So it's important to remember that testosterone isn't just about sex drive thought. It also contributes to maintaining strong muscle and bones, emotional well-being, overall vitality, cognitive health, and restful sleep. So the potential disruption to this crucial hormone is something to be aware of for anyone taking statins. So let's talk about another important nutrient that statins can interfere with, vitamin K2. And this vitamin is actually vital for protecting your arteries against calcification. In fact, vitamin K2 along with vitamin D and calcium make up an essential trio for healthy aging. Here's how it all works together. See, first we have vitamin D, often called the sunshine vitamin. This nutrient helps your body effectively absorb calcium. And calcium is like the building block for your bones. But calcium can do its job properly without the help of vitamin K2. Once you've absorbed the calcium, vitamin K2 comes in and guides it to where it's needed most, into your teeth and bones. In doing this, vitamin K2 not only strengthens your skeletal system, preventing conditions like osteoporosis, but it also ensures the calcium doesn't build up and calcify in your arteries. This helps prevent serious cardiovascular disease. It's an amazing synergistic relationship that keeps our bodies working in harmony. But the problem is statins have been shown to actually hinder the production of vitamin K2. This can disrupt the whole delicate cycle. A 2015 study found that people who were frequent statin users exhibit accelerated calcifications of their coronary arteries. This is a concerning side effect, as the whole purpose of taking statins is to actually reduce cardiovascular disease risk in the first place. So we have this essential trio, vitamin D, calcium, and vitamin K2, that work together to support our heart and bone health. But statins can actually interfere with the vitamin K2 piece, potentially undermining the very benefits they're meant to provide. It's an important consideration for anyone taking these cholesterol-lowering medications. Statins have also been shown to deplete levels of another incredibly important nutrient, coenzyme Q10, which is a naturally occurring compound found in every cell of our body, and is often compared to a spark plug in a car engine because it helps reduce energy in our cells, making it one of the most vital nutrients we need. Your heart muscle beats over 100 times a day, so it has a constant need for this energy boosting coenzyme Q10. However, just like with vitamin K2, studies have found that statins can actually reduce the level of coenzyme Q10 in the body. And this depletion of coenzyme Q10 can decrease the number of mitochondria in our cells, which affects overall body function. This can make you feel tired or weak, and it can even impact your heart's ability to pump efficiently. In fact, a 2004 study looked at people with high cholesterol who were actually otherwise healthy and found that 71% of them experienced a condition called asymptomatic diastolic dysfunction after just 3 to 6 months of taking 20 milligrams daily statins. This is an early sign of heart failure. But the researchers also found that when those participants were given a daily coenzyme Q10 supplement, this diastolic dysfunction issue went away. They concluded that the widespread use of statin drugs may actually be aggravating the modern epidemic of heart failure and atherosclerosis. So, what can you do to try to reduce your risk of these statin-induced nutrient depletion problems? Well, first and foremost, have an open and honest conversation with your doctor about whether you really need to be on taking statins in the first place. It's important to actually carefully weigh the risk and benefits. In addition, you can try to incorporate more dietary sources of the key nutrients that statins tend to deplete. For vitamin K2, focus on foods like aged hard cheeses, egg yolks, and fermented vegetables. And for coenzyme Q10, try to eat more organ meats, beef, sardines, mackerel, and my favorite, beef heart. Getting these important cofactors from your diet will help offset some of the detrimental effects of statins. However, dietary sources might not provide enough to offset the depletion caused by statins, so to be sure, blood tests can help monitor the levels of these nutrients and ensure you're not deficient. And if you are deficient, supplements are available and have seen good results, improving energy levels, strength, and reducing the risk of heart disease.